If you're diabetic, you probably hear about blood sugar or blood glucose all the time. But what does it mean really? Why should you care, and how does it impact your life? And which people are at risk? These are critical questions that deserve immediate answers, and we're getting into that right now. In this video, we'll cut to the chase and break down an otherwise complex topic so you can protect yourself from the risks of high blood sugar. Plus, you'll also discover why it's not just about blood sugar and what the real threats are, why you shouldn't ignore a simple headache, and how infections play a significant part in blood sugar levels. Now, before we continue, please don't forget to like this video and subscribe to the channel. Subscribing keeps you connected so you get our latest Diabetics Talk videos. And remember to click that bell so you're the first to know when we release new content. And stick around to find out how to claim your 2 free gifts, so keep watching. Okay, so first we need to talk about a hormone called insulin. Think of insulin as a unique key that unlocks the doors to your body's cells. When your body behaves itself, those open cells let your blood sugar in and use it for energy. Now, what role does insulin play in the big picture? Well, to answer that, we also need to know, what is high blood sugar? Abnormally high levels of blood sugar create a medical condition known as hyperglycemia, which is not to be confused with low blood sugar levels, also known as hypoglycemia. Blood sugar levels build up when your body fails to make enough insulin to remove it, or if you have enough insulin but the cells in your body ignore it and stay closed. When that happens, the levels of sugar in your bloodstream increase. You do not want undiagnosed, untreated hyperglycemia, as it's potentially dangerous. Who gets hyperglycemia? You're most at risk of hyperglycemia if you have type 1 or type 2 diabetes, but anyone can get it. Non-diabetic risk factors are illness, undue stress, and steroid medications. And by the end of our video, you will know the 10 most common high blood sugar warning signs. These warnings don't mean you have hyperglycemia already, but they are potential risk factors. So please take them seriously and see your doctor if you have any of these symptoms. Okay then, get comfortable as we explore the 10 high blood sugar warning signs. It's important not to demonize blood sugar or glucose. See, blood glucose is quite normal as your body uses it as a primary source of energy. The problems occur when blood sugar levels get too high and stay that way. Persistently high blood sugar or hyperglycemia makes your blood thick, sticky, and slow. And when left undiagnosed and untreated, it can lead to serious health complications. Some of the most severe long-term complications linked to hyperglycemia are cardiovascular disease, kidney damage or failure, nerve damage or neuropathy, eye damage and vision loss, teeth and gum infections, plus bones and joint problems. Extreme complications can lead to amputations or life-threatening diabetic coma. These are the reasons why you should recognize and act on high blood sugar warnings. Early diagnosis and treatment are how you avoid or effectively treat hyperglycemia. Your doctor can test for hyperglycemia with a simple, on-the-spot blood test. According to the World Health Organization, you have the condition if your blood sugar levels are greater than 7.0 millimoles per liter or 126 milligrams per deciliter while fasting, greater than 11.0 millimoles per liter or 200 milligrams per deciliter 2 hours post-meal. So without further ado, let's begin the countdown, starting at number 10, chronic fatigue. High blood sugar levels mean you're not making enough insulin, or it's not working properly. In either case, the glucose isn't moving from your blood into your cells to provide energy. And it's this lack of energy that could be the cause of your tiredness or chronic fatigue. Moreover, extreme tiredness can affect everyday living and lifestyles. Your mental, emotional health, and self-esteem can suffer if you ignore these warnings. Several studies found definite relationships between hyperglycemia and exhaustion. That includes type 1 and type 2 diabetes and undiagnosed prediabetes. Some causes of fatigue are less clear and may not have direct links to hyperglycemia. Even so, your fatigue can still be connected to other diabetes-related symptoms. That's why it's vital you get a professional diagnosis sooner rather than later. Number 9. Headaches, including migraines. Recurring headaches could mean you have high blood sugar levels or hyperglycemia, but low blood sugar, hypoglycemia, can also trigger painful headaches or migraines. Head pain tends to intensify when there are fluctuations in your blood sugar levels. Headaches caused by high blood sugar can take days to develop. The pain tends to be mild to moderate in the early stages of hyperglycemia. Sugar, suggests one study, triggers headaches and migraines in some people. Another study found a probable link between migraines and glucose metabolism. Untreated high blood sugar may result in more frequent, intense head pain. The National Headache Foundation defines high blood sugar headaches as a dull, throbbing pain mostly centered around the temples. You'd be wise to get your sugar levels checked if you start to develop unexplained headaches. Number 8. Shortness of breath. Your respiratory system has 5 parts. It includes your mouth, nose, windpipe or trachea, lungs, and diaphragm. In healthy adults, 12 to 20 breaths per minute is considered normal. There's something wrong if your breathing becomes tight when you're in a rested state. A potential complication caused by high blood sugar is impaired lung function. People with type 2 diabetes have 3 to 10% lower lung volumes than those who don't have the condition, and that can cause you to experience shortness of breath. At the last count, 46% of people in the world with diabetes remain undiagnosed. In a worst-case scenario, rapid or forced breathing, called Kussmaul breathing, could be a symptom of a condition known as diabetic ketoacidosis, or DKA. A 2019 study first published in the World Journal of Diabetes saw that respiratory failure during the treatment of DKA increases mortality rates. If you're diagnosed as a diabetic, shortness of breath may also suggest heart disease. Number 7. Stomach pain. Lasting high blood sugar levels can damage your blood vessels. These critical vessels supply your nerves and organs with vital oxygen and nutrients. One of the roles of your nerves is to move food along your gastrointestinal tract, or GI. But as they become damaged, your muscles stop working effectively. So food sits undigested in your stomach for longer than usual. This delayed gastric emptying even has a name, gastroparesis, and it's the cause of stomach pains. Typical symptoms are bloating, stomach spasms, acid reflux, and other side effects. And according to the American Diabetes Association, up to 75% of patients who visit diabetes clinics present significant GI symptoms. Don't suffer in silence, hoping the pain will go away. Get it checked now. You're worth it. Number 6. Tingling or numbness in your hands and feet. Over time, high blood sugar ravages the tiny blood vessels that supply your nerves. That includes the ones responsible for sending signals to your extremities. It's a condition called peripheral or diabetic neuropathy, or DN. DN includes several progressive nerve disorders caused by hyperglycemia and high triglycerides. Typical symptoms are tingling sensations or numbness in your hands, fingers, and toes. In some cases, though, DN results in more intense or burning diabetic nerve pain. A few lifestyle adjustments can vastly reduce your risk of DN complications. That includes controlling your blood pressure, healthy diet, and an active lifestyle. Check in with your physician if you start to get any of these symptoms. Now, before we count down the final 5 blood sugar warnings, don't forget to grab your free copy of our Superfoods for Diabetics ebook. There, you will discover a world of exciting diabetes-fighting, nutrition-packed foods. Plus, learn the secrets about diabetes and your health from leading medical experts in episode 1 of That Diabetes documentary. You won't want to miss these 2 amazing free gifts, so click the link below to grab your copies. Okay, let's get back to the countdown. Number 5, recurrent infections. Your blood sugar levels might be high if you suffer from recurring infections. Some of the nastier ones are colds, influenza, and even pneumonia. Respiratory infections occur because hyperglycemia impairs your immune system. That results in fewer white blood cells fighting your corner to kill viruses. High blood sugar levels don't stop with respiratory infections, they also feed yeast growth. That can lead to fungal infections on the skin and inside your body. Common complaints are severe vaginal and oral thrush, plus bladder infections. These are not recent discoveries. The link between hyperglycemia environments and immune dysfunction is well documented by science. Number 4, slow healing sores. Previously, we talked about how hyperglycemia causes neuropathy or nerve damage. Well, damaged nerves can result in poor blood circulation too, and the harder it is for your blood to reach and repair areas of infection, the longer it takes sores to heal. A 2013 study published in the Plastic and Reconstructive Surgery Journal found a clear link between high blood glucose levels and slow wound healing. And here's a warning. Never ignore slow healing sores like blisters, cuts, and grazes. The longer you leave them, the higher the risk becomes of even more severe conditions. Untreated sores can lead to fungal and bacterial infections, including gangrene. Number 3, nausea and vomiting. Have you experienced recurrent episodes of nausea and vomiting for no apparent reason? If yes, it's time to visit your doctor's office without further delay, and here's why. Your body may be in a persistent state of hyperglycemia. That can cause a buildup of chemicals produced by your liver and released into your blood called ketones. Excessive levels of ketones are toxic to your system. It's a potentially fatal condition called diabetic ketoacidosis, or DKA. Nausea and vomiting could be signs of DKA. Others are abdominal pain, dry mouth, shortness of breath, weakness, confusion, and even coma. Number 2, blurred vision. Blurred vision is not only frustrating, it can also be dangerous for obvious reasons. Hyperglycemia can cause temporary problems if the spike is short-lived. See, high blood sugar makes the lens of your eyes swell, which affects your ability to focus. So bringing your blood glucose back to within normal range fixes the problem. But it can take 6 or more weeks for the swelling to go down after your blood sugar returns to normal levels. Hyperglycemia can lead to severe other eye-related complications. Some examples are cataracts, glaucoma, and diabetic retinopathy, which can even cause blindness. Number 1, unquenchable thirst and frequent peeing. Are you constantly thirsty and spending more time peeing than is normal? It could be that your blood sugar levels are persistently high. See, too much glucose in your bloodstream causes your kidneys to work overtime. It's their job to absorb and filter any excess buildup of blood glucose. But when your sugar levels are too high, your kidneys find it hard to keep up. So your body must excrete the leftover glucose into your urine. It's a condition called polyuria, and the reason you're peeing way too much. Another problem with this bodily process is that it flushes out hydrating fluids, and the more you urinate, the thirstier you get, and so the cycle continues. But high blood sugar levels are only one of the possible causes of polyuria. Bladder infections, kidney stones, or failure, sickle cell anemia, and some cancers are others. As the problem worsens, toilet visits can disrupt your sleep and drain your energy levels. Whatever the root cause, have your doctor check you out for a peace of mind. Diagnosis usually starts with a urine 24-hour collection or a volume test. And that concludes our top 10 countdown of high blood sugar warning signs. Have you experienced any of the common signs of high blood sugar levels? How were you diagnosed, and what have you done to fix the issues? We'd love to hear your experience, so why not let us know in the comments below. Oh, and remember to subscribe to our channel and hit that bell button for early notifications. We're Diabetics Talk. It's our mission to bring you valuable tips, tricks, and updates, videos that help you fight obesity and manage your diabetes. And don't forget to claim your 2 free gifts by clicking the link in the description below. Thanks for watching, and we'll see you again in the next video.